All right, welcome back to the Dr. America show. Thank you guys for tuning in. I'm your host, Dr. Sanjeev Sriram. And for today's episode, we are recording on November 4th, Election Day. And hopefully you guys all voted because voting is critical for your health. It is critical to your individual health, your community's health, America's health. There were elections happening everywhere at every level, city, county, state, and all of these officials play a really vital part of deciding our health services. And a lot of things are important to our general health and well-being. So hopefully you guys voted and did your part. Okay, so last week we talked about Ebola and the danger of using fear in developing and implementing public policy. When we ignore evidence, data, and hard facts, and we create policies that satisfy fear and cynicism, we end up with the state-mandated police quarantines like the one that Casey Hickox endured in New Jersey. But over the course of today's episode, we're going to learn that, fear-based policies don't really stop there. Many of the most dangerous policies in America are based on our worst fears and prejudices, not facts. Just look at voter ID laws, stand your ground, and stop and frisk. None of these policies are rooted in evidence. There is no proof that voter fraud is a threat to democracy. There is no proof that stop and frisk makes the police more effective at practicing and serving the public. There is no proof that the policies using racial profiling as a methodology make America more secure. Today's episode airs on the 3-month anniversary of the death of Michael Brown in Ferguson, Missouri. All of our thoughts and prayers continue to be with his family, and we pray that their struggle for justice and peace is answered. Many of you may be wondering, what does any of this have to do with health? And that's a fair question because, after all, I am not an attorney and I do not have an education or training in criminal justice. And I recognize those limitations, and I will defer to the other programs on the We Act Radio Network and elsewhere to contend with the issues surrounding the grand jury, prosecutors, and the police. The point of today's episode is to look at Michael Brown's life in a much broader context. I believe that young man faced a range of injustices long before he ever met Officer Darren Wilson. The injustices of poverty, access to health care, unemployment, and how all of these problems fall on the lines of race, all of this is dangerous for our health and as a country. Health is not just something that happens in the doctor's office. All of these things play a really important role. I have so many patients in Southeast DC whom I see for 15 or 20 minutes a year, and then they face a bigger world that challenges their well-being. And we're left with these questions of, will they survive? And if so, will they thrive? And this is a huge topic. And, we're going to, take our time with it, do it piece by piece, and hopefully try to understand some of these social determinants of health, both in Michael Brown's life, in Ferguson, Missouri, and dig into some of these really, really tough questions about how do civil rights play a role in our collective health? What impact does racial profiling have on individual health, on family health, on community health? And what can we do about all of this? In order to kind of break some of this down, I'm going to kind of explore different elements of social determinants of health with an eye on Missouri, but I think a lot of this can apply to other parts of the country as well. And we're going to jump right into this as soon as we come back from this break with a talk about expansion of Medicaid and what access to healthcare means for people of color and for the people of Missouri.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show. My name is Sanjeev Sriram, and I am your host. Today's episode, we are talking about the social determinants of health that Michael Brown in Ferguson, Missouri faced over the course of his life before it was cut short, and to kind of look at how these social determinants of health impact all of our health. And I think a good starting point to kind of understand some of the disparities between Black and white populations in Missouri is to look at, the expansion of Medicaid under the Affordable Care Act, because Missouri is one of 24 states that is not expanding Medicaid. Their state legislature was debating the issue, but they have not taken action just yet. And just to remind everybody, under the Supreme Court's ruling on Obamacare, states have the option of whether or not to expand Medicaid. And what that means is that states can choose to work with or not with the federal government to include single parents and childless adults earning up to 138% of the federal poverty level, or about $33,000 a year for a family of four in their Medicaid program. Now, where Missouri is at in all of this is that if you are a parent in Missouri, you qualify for Medicaid if you earn about 23% of the federal poverty level. That is $5,500 a year for a family of four. Let me say that again. In Missouri, to qualify for Medicaid, if you are a parent and you are earning $5,500 a year, $5,500 a year or less, then you qualify for Medicaid. If you start earning more than that, then you do not qualify for Medicaid as a parent, but your children continue to be insured. And now, if you happen to not be a parent, if you are a childless adult, it doesn't matter how much you earn. You do not qualify for Medicaid in Missouri under any circumstances. And that is the current state of affairs with Missouri's Medicaid program. And what this means is that there are 260,000 people in Missouri who are stuck without healthcare coverage. They earn too much to be in the state's old Medicaid program, but they don't earn enough to shop for health insurance on the federal exchange. They earn more than that $5,500 a year, but they don't quite make the $33,000 a year that they would need to buy the health insurance on the federal exchange. So across the country, there are about 5 million Americans who are stuck in this coverage gap, and Missouri's share of that is 260,000. So what does this have to do with race and civil rights? So let's take a look at how different populations are doing under the Affordable Care Act. So before the act went into law, just to kind of give people like a background picture, minorities were more likely to be uninsured than white Americans. African Americans make up about 12% of the U.S. population, but they make up 25% of African Americans are uninsured. Similarly, Hispanics make up 16% of the U.S. population, but 33% of them are uninsured. And just to kind of give you some comparison numbers with white people, they make up 72% of the general population, but only 15% of white people are uninsured. So you can see that there's a lot of disproportion between different minority groups, and a lot of this has to do with their poverty. 59% of African Americans and 51% of Hispanic Americans have incomes that are at or below that $138,000 federal poverty level. Like, they're earning $33,000 a year or less. And just by comparison, 42% of white Americans are in that income bracket. Now, that's kind of, that's how things were before the Affordable Care Act came into implementation. And so, now we have to kind of look at those, that whole situation again, remembering that 24 states are not expanding Medicaid, And, some states are running their own health insurance exchanges. A lot of states are relying on the federal exchange. But in order to be in the exchange, remember, you have to be making at least $33,000 a year. That being said, this is what Obamacare has meant to minority health. The rate of uninsured African Americans went from about 25% to 16% nationwide. And then with Hispanic Americans, it went from 33% uninsured to 16.5% uninsured. Now, that is a huge improvement of uninsurance, okay, for these minority communities. And it's something really that, points to the Affordable Care Act actually accomplishing a civil rights goal, which is that you should be able to access the doctor when you need one, regardless of what you look like. And the Affordable Care Act, where it has been implemented faithfully and with cooperation between state government and federal government, you're actually finding that it is accomplishing this important civil rights goal of health equity. And I think that that's something that's really important for us to remember, because a lot of that leftover gap, those 5 million Americans, is really because we've got 24 states not expanding Medicaid. And Missouri is one of those states not expanding it. And I think that that a lot of us, that when we look at these states that are not expanding Medicaid, and we look at the coverage gap, and these families who are lacking health insurance coverage for no other reason than because they happen to live in the wrong quote unquote state. I think that we should be reminded by Dr. Martin Luther King Jr.'s quote that of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. That's something our state legislatures, need to consider when they play political games with Medicaid expansion, because it really is imposing a kind of second-class citizenship on our fellow Americans, whether these politicians at the state level intend to do that or not. And it's something that, that is actually a very feasible, very doable goal to improve health equity across the country, is to expand Medicaid. So, there are more social determinants of health besides access to care. And when we come back, we're going to be talking about education, and we're going to be talking about Ferguson, Missouri, and Michael Brown's community. And to kind of explore a lot of that, we have one of We Act Radio's superstars, and you guys should definitely come back to listen to this next part.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right, welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, and we've been exploring in this episode some of the social determinants of health that were a part of Michael Brown's life in Ferguson, Missouri. In the last segment, we covered access to healthcare and how expanding Medicaid is actually really important for the civil rights and for the health equity that we should be creating in this country. And in this segment, I want to kind of look at another social determinant of health, and that is education. And I really am interested in this young man's story, Michael Brown's story with his own education, because I think that it actually can illustrate to us what was tragically cut short, and what opportunities and challenges there are for building health equity by improving the education of our young people. So just to let you guys know, I don't know whether the story got as much circulation as it should have, but in March of 2014, Michael Brown sat for his high school photo, and it was a senior year, so he gets to wear this cap and gown. But the interesting thing is that his high school, Normandy High School, was so strapped for funds that it could only afford 2 sets of caps and gowns. That meant a student would put on the cap and gown, get their picture taken, and then take that cap and gown off and hand it to the next student in line for the photos. Um, the school, was struggling with some poverty, and some of that was a reflection of the community that was also struggling. And to give us a better idea of that Ferguson, Missouri's community struggle with poverty and how that poverty fell on race lines. We have with us one of We Act Radio's superstars, Linda Tirado. She is the author of Hand to Mouth, Living in Bootstrap America. And Linda, thanks so much for joining us today.
I'm pleased to be here.
So, since you've actually, been to Ferguson, Missouri, and you were there this past August, before we got started recording the show, you were telling me a little bit about Ferguson, and I think that description would actually help us, get a better picture of what Michael Brown's life was like in Ferguson, Missouri, for people who haven't had a chance to visit there.
Sure. Well, the common perception is that it was fairly low income, and it's actually not the case. Ferguson's a pretty average suburb of St. Louis. There were definitely some blocks that, weren't as well maintained, but you're talking, houses with statues in the yards, not a block and a half away from where the protest zone on Florissant was. And the way it's set up is actually they've got 2 main roads, and they have 2 ways that you can kind of connect in between them, and one is mostly white people and one is mostly black people. So the upscale restaurant is on the white section near the police department, and the carry out is in the black section. But it isn't, the projects or anything. Like, it's people with jobs and cars and houses. So I think that's a thing that a lot of people, you can hear about, the 2 graduation gowns, but that isn't only Ferguson feeding into that school. So the school's problems are actually, more broadly St. Louis. And you hear a lot about education when you're there. People talk a lot about the schools, and they talk a lot about unemployment, especially amongst the young people, and especially amongst young black males. Unemployment is really problematic. But on average, yeah, it's just kind of a normal place that people live that's very, very segregated.
And when you talk about that segregation, these are families that are within view of each other. At least from your description, it sounds like that. And they're seeing each other, and then there's interacting with each other. Right. And from your experience and from your vantage point, how much of like real world interaction did these families have with each other?
That's really hard for me to say, because by the time I got there, the situation was not normal in Ferguson anymore. I will say that the majority of employees on the black side of town are people of color, and the majority of people working on the white side of town in the places that I visited were generally more white as a rule. But that is so anecdotal, and I did not stop in every store, and I'd hate to, kind of go out on that limb too far. But look, racial tensions in St. Louis are on record, right? They're kind of a huge deal there. And that's going to spill over into every aspect of your life. It's going to be your working life and where you live and how you interact. I mean, most of the people in Ferguson that I know anyway, residents from like Florissant in that area, didn't know the police chief before all of this happened, and they didn't know, the police officers necessarily that well, and things like that.
And it's interesting that you bring up that that interface between the public and the police. So just to remind our viewers, can you describe how those numbers play out on race lines as far as like what percentage of the police were African American, and compare that to the population that they were policing.
Right. Well, I mean, there's only a few black officers on the force. It's majority white, and the part of town that they're policing is nearly entirely black. So that's pretty much it. You've got white people with guns making sure that they're spending their time in the black section of town.
Right. And another picture that I'm kind of curious about is that of unemployment, which you had briefly mentioned earlier. And when it comes to unemployment, did you get a sense, or afterward, did you get, looking back, I guess, from that retrospective, how that unemployment played out on racial lines? Was it disproportionate that the black families were unemployed and whites were not, or was it about even because of the recession?
I mean, I can't give you hard numbers on that, but I can say that we know what the pattern is there, and it was playing out in Ferguson, where the black unemployment rate, and particularly the young black male unemployment rate, is, some ridiculous percentage and exponential to what the average is. And we know that happens in nearly every case. You can't go to a place that's that racially polarized and not see those figures play out. I wouldn't be able to tell you exactly what the numbers are, but what I can say is that for every night I spent out with the protesters, I heard about the unemployment problem from them. It was constant, and we were, on the heels of this person dying on the street in their town. There's tear gas, and there's APCs, and there's LRADs, and they're being traumatized. And what they're talking about is the unemployment rate. So, that is fairly indicative, I'd say, of what the situation is.
Yeah, and I'm really glad that you're able to give us this portrait, because one of the things that I found very striking was that Michael Brown himself was actually working towards beating some of those odds.
Yep.
He had just completed an education program to get his high school diploma a little over a week before he died, and I'm trying to remember that he was supposed to enroll and start in a vocational training program. Is that right?
Yeah, I think so.
Okay. And so, and I think that this is where, when it comes to education, I really, and I mean, it's not just me, it's the public health community that really is trying to encourage families to, get as much education as they can, because it is so important for, individual health and for family health and for community health. Because and it feels this one feels a little bit obvious, because the more schooling you have, the better your chances are at earning more money. That's not always guaranteed, and we can talk about that.
Yeah, it's increasingly not guaranteed, but broadly.
But broadly speaking, right? I mean, it's definitely better to get a high school diploma than not.
Right.
And a person improves their chances at the next levels of education by completing the earlier parts of education.
But I think we're looking at it wrong when we look at it like that, because the question really shouldn't be how to make everybody more broadly educated so much as how do we make it so that if you don't have that education, you aren't cut off from these support networks and these systems. Like, not that education isn't a fantastic goal, but when you're looking at the public health perspective, I really think it's more how do we make sure that we're taking care of our citizenry regardless of the level of education they've been able to manage.
Right. And I think that was actually kind of, I think, one of the points that maybe I didn't make as concretely when I was talking about the expansion of Medicaid. But, that's where I think, giving people the basic right to see the doctor when they really need one is a big part of what the expansion of Medicaid means, is that they're not going to keep looking at your income level to determine whether you are, quote unquote, worthy of getting health insurance. And
because we're still going to need people to work at McDonald's, right? Like, we're still going to need people to sweep floors. It's just always going to be true.
Absolutely. And these are our fellow Americans. I think that that's the perspective of health that I'd like to think that we can move towards. That, just as you're saying, regardless of educational outcome or ability, that we still attain that we still attain the best possible health that we can. I think that the point that I was looking at really when it comes to education was that Michael Brown himself was doing what he could to pull himself up by his bootstraps. He was, resources limited. He's
Right.
looking at his own hometown where, just as you're describing, unemployment is disproportionate. And
He was doing the proper steps that we demand out of people before we get them the social resources, right? Like he was doing it properly.
right, and I think that is actually, I would like to think that we can fulfill our promises to people who do that type of work. When we make this pledge to our fellow Americans that if you work hard, if you really do well in school, if you stick with it, you can do better in life. And I think that is, I'd like to think that health would be a part of that, because with people like Michael Brown doing what they can, I'd like to think that his health would actually have improved had he been, as diligent as he was in life.
I mean, and I would also submit that maybe we just need healthcare to have better lives, because death is a very bad option
Right.
to have a good life. I mean,
Right.
let's just put that one out there too.
Right. Right. And actually, coming back to one of the education things that I found pretty interesting was that at the same time that Michael Brown was getting his high school photo taken, the U.S. Department of Education, their Office of Civil Rights, released a very important report. And it was the first time in 15 years that they had gone through the kind of data that they did, looking at all 97,000 American public schools, and that's about 49 million students. And some of their findings were actually pretty interesting, because it showed that about 40% of public school districts do not offer preschool.
Mm-hmm.
And where it is available, it's only available part of the day.
Right.
When it comes to advanced courses, I was one of those, I was probably like one of these kids in this report where it says 81% of Asian American high school students have access to things like, the advanced science and math classes of, Algebra 1 and geometry and calculus and biology and chemistry classes. And, I grew up like that, but unfortunately, only 57% of Black students have access to those kinds of courses. Mm-hmm. And even when it comes to things like, college counselors, we, have done a really sad job of giving these kids the kind of supports that they need to really pursue those dreams, however big or small those dreams are. And I think that's, and it's a tragic statement of what we are telling them in our rhetoric and what they are facing in their reality.
Right. And I actually have this book that I wrote pretty much about that, about what
Please
it
tell
is.
us about the book.
No, actually, it's I bring the book up not because I wrote it, but because you can literally write an entire book about what it is to be told, just work hard, follow the rules, and you'll, do okay. And then to see how unattainable it is and understand that the reasons that it's unattainable are systemic, that they are built in, that they are inescapable. And then to have to really think about, well, how am I going to move forward? And even just dealing with the logic that it takes to make all of those things work together in your head is an actual health problem. We know that if you're fairly poor, and I'm talking like working class, I'm not talking, impoverished on the street. We're talking about 45 million Americans, about a third of us. Mm-hmm. We are operating with so much stress from having to make all of this work in our heads. It's like we're operating without a night and a half of sleep at all times. Like the physical toll is amazing, much less the mental toll.
Right. Right. I mean, and that's a great example of the impact on individual health of, this community-wide problem has this really, really drastic effect on individual health. And then I can only imagine that if were to now expand that out to like how families, try to cope with, with wages not really bringing in what they used to, with education systems not really like delivering, for
Well, I mean,
kids.
if nothing else, this is why fast food workers are, throwing up in the back and then going back to the boards to finish their shift. Like the impacts that this has on every level of public health is clearly like kind of frightening and a bit astounding. But yay America. And that's just kind of how we do.
Yeah, and the sad thing is that it does not have to be this way. I mean, when you look at something like universal preschool, which
Right.
Universal preschool that is all day,
Mhm.
like that is actually answering a lot of working class families' needs all at once. Like you're answering a childcare issue for those parents. For the child themselves, it's a powerful experience, and there's a lot of interesting public health research, education research showing that for kids coming from disadvantaged communities, having preschool is disproportionately beneficial.
Yes.
To those kids, and for the rest of us, who are not in preschool and we may not have children. It's interesting to note, and I found this Chicago study actually very fascinating, where they found that for every $1 that got invested in preschool, there was a $7.10 return to society.
Yep.
It's just and I don't know. I don't know if you're familiar with this study, but it's interesting to speculate where that $7.10 is coming from.
Well, you're talking about things like just better outcomes in general, right? So then you extrapolate all of those outcomes and how much we're spending in public health and prisons and in education, and how much more that person is going to create instead of need. And you just kind of extrapolate that all out. And yeah, that is how big of an impact it makes, because what you're talking about is a whole community of people that now are getting educated at an earlier age, and they're keeping synapses open that would otherwise close. You're legitimately changing lives here, and when you do that, and when you give a child that much stability, they can do amazing things, and they grow up to be people who don't have to spend time figuring out all of these things that other kids are learning when they're 3 and 4 years old.
Right, and it's giving those kids the brain power that they need to get their academic career started with the best possible starting point that they can have.
Right.
And let's not forget, preschool is jobs.
Yep.
those kids need preschool teachers, and that is
Janitors and cooks
and
yep,
right,
school nurses.
right, and those are the kinds of jobs that actually stay in those communities.
Yep.
That's one of the powerful things about preschool jobs, which I don't know whether our public is really appreciating that. And I don't know whether the advocates, on the political end, in our leadership, I don't know whether they are really conveying that preschool is a jobs program.
Well, and the other thing that we don't talk about is that we already had universal preschool, and it wasn't that long ago. During World War II, there were so few men, and women stepped up and started working, and that left all of these families that had no childcare solution, because before that, women had stayed home to take care of their children. And so the government actually instituted universal preschool, where women would just go and drop off their kids before they went to work and pick them up on their way back home. Not only did they give them preschool, they gave them pre-cooked meals to take home and warm up. We used to do that for our citizens because we understood the impact and the societal benefit that you would get out of programs that created that much stability.
And do you think that we've lost that because we've lost touch with each other, or do you think that some of this is a class problem, that we're segregated by class, we're segregated by race, or do you think it's from other factors that we've lost that that sense of unity and community?
I mean, I don't think there is one answer, but there's a few things that I always point to that I think are hugely influential. The first is the amount of money people think we spend on social programs like this versus the amount of money we actually do. People tend to wildly overestimate how much we spend on social welfare programs. And I'm not talking about entitlement spending, but, things like daycares and community gardens and stuff like that. They will generally consistently overestimate that hugely. Secondly, I think that it's a political problem. I think that when we had things like that, our presidents used to say things about how it would be wrong of us as Americans to allow a corporation. I mean, look, we have Eisenhower still warning us about the military-industrial complex, right? And now we have politicians that basically are really excited about the military-industrial complex because it means they'll get to make some money, and we spend huge, vast amounts of our money supporting those things. And I don't even think it's necessarily just the military spending, but that's more the point of the rhetoric has changed and the politics have changed to the point where you could not have a president come out and say those words anymore. And it's just not going to happen. And thirdly, I do think it's a separation problem because if you have never not had daycare at the tip of your fingers, how do you know what it's like to not have daycare available and what sort of an impact that makes? And so if we're not living together, which we increasingly don't, we're increasingly self-sorting. If we don't live together and we don't work together, how are we supposed to know the needs of most Americans? Because as far as we know, our needs are the needs of most Americans because it's what we hear everywhere.
Yeah, no, and I'm so glad that you're able to kind of share this perspective with us and these insights. And it really does remind me of that other Martin Luther King Jr. quote that it's all right to tell a man to lift himself by his own bootstraps, but it is just cruel to say to a bootless man that he ought to lift himself by his own bootstraps. And
Right.
it seems that there was a time where we understood that bootstraps had to be connected to boots,
Right.
in order for for that pulling up to be meaningful, productive, and to join the rest of American society. And it's unfortunate that we seem to be losing touch with a lot of that.
Absolutely. I actually, it's one of my favorite metaphors, bootstraps, because it essentially is asking you to levitate. I mean, do the impossible, and then you will have succeeded.
Yeah. And as Dr. America, I don't know whether I really want to be championing superpowers such as
Levitation.
levitation.
Yeah. Well, I
and-
mean, listen, flying is one of the cool ones.
Right, but not all of us are born Superman. With just all you need is some sunlight and some Kryptonian.
Right.
Is some Kryptonian genes, and you're all set. But I think that a lot of this is a helpful reminder that we are part of that web of mutuality.
Well, and I always wonder why people think everybody needs to want a lot of money to begin with. It's totally possible to be the sort of person that doesn't necessarily want to climb any ladders anywhere. Maybe you want to garden and have a nice quiet life with your family. And I don't understand why we're punishing that so much. Why wouldn't that be considered a good life outcome? If you are healthy and reasonably happy, why wouldn't we want people to just be able to go get a job and survive like that? And where does the bootstrapping need to happen and why? Because what I think part of the problem too is that we've consistently pushed okay higher. It used to be just okay to go work at a factory, right? It was
Right.
fine. You were working, you had a job, you were contributing. And now you need to have a job in an office because if you're very blue collar, then you're doing it wrong.
Right.
And when did
right.
that happen?
Yeah. No, it's so true. I think that we've lost sight of what acceptable normals are, and the idea that that we need to be living the lifestyles of the rich and famous, and that's the only way to be happy and to have your needs fulfilled. I think it's a pretty tragic development of our consumer culture.
Yeah, I mean, because that's essentially what we're seeing happen, where people with just normal jobs still aren't getting health care. We don't think they deserve it anymore, because if they wanted it so bad, they would have earned more.
Right. One of the other parts of preschool, this report that came from the Department of Education this past March that I found particularly interesting was the way that children are punished. And they actually looked at suspensions, for the first time.
Right.
And, I was actually as a pediatrician, I was very bothered by a finding that said that Black students represent 18% of preschool enrollment, but 42% of students who had been suspended once, and they represented 48% of students who had been suspended more than once.
Right, and underscore, this is a study on preschools. We're
Right.
talking 4-year-olds here.
Right.
Yeah.
Right. And and these trends don't improve over the course of that academic career.
Right.
They were
They
finding
get worse, actually.
Right. And that Black students are suspended and expelled at a rate that is 3 times higher than white students. And so I think that that's one of the things that really concerns me is that, we are trying to talk about education as this, social determinant of health. It's, that it can be a launch pad to, these, to whatever kind of life you're looking for. But if you are looking for a better life, that it is, one of the gateways.
Right.
And then we are punishing these kids as young as 4 years old, and at such disproportionate rates that it feels like we are reinforcing a preschool to prison pipeline.
Yes.
And through racial profiling, it feels.
I would say it's more than feels. That's a fact. We do that. That's what America does. I mean, and we have to accept that. Now, is it a good thing or a bad thing? I suppose that depends on, how much of a racist you are. But we do that. We disproportionately punish very small children because they have more melanin. And that is horrifyingly bothersome, but that doesn't make it untrue.
And what I find, and I think that what we really need to do is find a way to remove this element from education. That education can be that promised pathway.
Well, I mean, and that's a matter of funding. It really, really, truly is, because what we're seeing is increasingly, differentialized neighborhoods where you'll have, very strong concentrations of people of color and certain racial minorities, very strong concentrations of white folks. And we find that the funding tracks there because we're talking about property taxes, county by county, school by school. And if we had sort of a universal norm on the spending, then we get the outcomes in control. I mean, if you look at the news right now, just in the last couple of weeks, and I don't, off the top of my head, I'm looking at what's come across my Twitter feed, there are schools that don't have enough books to go around. There are teachers that are having to pay for school supplies. There's school districts that are spending, in the literal double-digit figures per pupil. So when you have those sorts of things, you have to go, well, what outcome are we expecting for kids that are in those situations?
Absolutely. Well, thank you so much for this, for this such a productive conversation. I think that this really did kind of put education in a very broad context. I think that, and I really appreciate your insights about Ferguson, Missouri, and everything that Michael Brown got to kind of live through as a young man in that part of the country, and for all of these valuable insights about, about what our working class families are dealing with in this new American economy.
Absolutely. Thank you so much for having me.
All right. Well, when we come back, we're going to continue our conversation about racial profiling and its impact on health with a very special guest. You definitely don't want to miss this one. We'll be back in a few.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right, all right, all right. Welcome back to the Dr. America Show. I am your host, Dr. Sanjeev Sriram, and today's episode we have been covering social determinants of health, how those social determinants fall along race lines in the United States, and what these social determinants meant in the life of Michael Brown in Ferguson, Missouri. In the last segment, we closed on a very disturbing trend that's happening in our schools with disproportionate punishment of minority students, all the way from preschool through high school. And, for this next segment, we want to kind of look at racial profiling and the impact that it has on health. And this is a pretty touchy subject. It gets very sensitive, but I'm very thrilled to announce the guide that we're going to have on this part of the journey. She is a close personal friend of mine, Dr. Yolanda Hancock, and I'm going to run through her bio a little bit. She is a fellow graduate of the UCLA School of Medicine, and she got her public health degree with honors from the Johns Hopkins School of Public Health. And in the spirit of full disclosure, the way that Yolanda and I know each other is when I was a medical student. She was an intern at Cedars-Sinai Hospital on the pediatrics ward. And when I decided to join that residency program, I was an intern and she was my senior resident. She has always been a terrific, terrific role model of how to be a healthcare provider for disadvantaged populations, and I am absolutely thrilled that we get to chat with her today because I really feel that her intelligence, optimism, and attitude will see us through a pretty difficult subject. Welcome, Dr. Hancock.
Thank you, Dr. Sriram. Thanks for having me.
Really excited to have you on here, Yolanda. And so, one of the ways that I think, I want to help the audience understand the connections between civil rights and individual health and public health and collective health, and the way that racial profiling can impact health, I think is to really kind of start with something very concrete that I learned that African American families go through, and that is that African American parents have a talk with their children, and for most for a lot of families, when they say that they're having the talk, they usually mean the birds and the bees talk. But in addition to that, I've come to understand that African American families have another talk with their children about how to interact with the police.
Yes.
And have you ever, received this talk as a young person?
I did. My mom gave me the spiel when I was in high school, and then I had the same talk with my brother when he was about to enter into high school. And I didn't appreciate it or the need for it at the time until I headed off to UCLA. I was actually an undergrad during the Rodney King situation. And so it was in those moments that I fully understood what my mom talked to me about in regards to how I engaged with police officers. I also happened to be in San Diego at the time of the Kara Knott murder, where a police officer pulled her over for what he deemed to be a justifiable stop, and later it was determined that she was sexually assaulted and murdered. So for all of those reasons, my mom felt the need to have that conversation with me, and I truly appreciate that she did.
And what I'm curious about is that are these experiences? The talk is mostly about the police, but I was kind of wondering whether these experiences extend to other professionals or institutions for families of color. I mean, both from your own personal experience and then also your experience as a healthcare provider.
It definitely does. I think that as people of color, we sort of live in two worlds. We live in the world in which, we're culturally ingrained with our families, and then there's the world outside, and it's usually referred to as the man's world or the white world, where you have a very good grasp of King's English. You make sure that you conjugate all of your verbs. If you get upset, You make sure to check your facial expression because you don't want to behave in a way that will fit into the stereotype that others may have of you, knowing that you may be the only African American that they have interacted with. And as a result of that, you certainly don't want to portray yourself in the way that they may perceive you based on what they've seen on television, based on what they've seen in the news. So my mom, on numerous occasions, would let me know that the way that you may act around your friends or even here at home has to be different than the way that you behave professionally. And I explain to my patients the same thing. I said, just because you feel like you have ascended in terms of your career, that does not mean that you can be lax in how you carry yourself. Because if you go out and you have what's called, sometimes classified as a quote-unquote attitude, and it's perceived that way, that may hold you back when you are in mainstream society. So it means making sure that you speak clearly, that you don't get too upset, that you do your best to follow the rules, even though sometimes those rules may change.
And what I find so sad about this is that it sounds like there's distrust on both sides. Is that there, because of the distrust that a lot of mainstream society, or like what you're saying, the man's world has in that they have a distrust of minorities, and then it sounds like from what you're also describing that there's a distrust from the minority community in a lot of these institutions where, you look at the police and it's, the police motto is to protect and to serve. And and it sounds like, there's this cycle of distrust. And what I'm curious about is that, how does that cycle impact, mental health and even physical well-being?
Right, it's stressful. I remember when I was pulled over in Los Angeles for failing to yield at a stop sign when I was on my way back from the gym. It's 5:00 in the morning. It's dark outside. I'm the only one on the street, and I was scared out of my mind because the car was an unmarked police car, and he had on a black uniform, not classically identifiable as a police uniform. So I was afraid to stop. But at the same time, I was afraid not to stop because I didn't want to get shot. So I slowly drove with my hazards on, and I kept yelling out the window, "I do not feel safe. I'm moving into a lit area." And I had to laugh after I thought about it because I thought to myself, if I was a white woman, would I have had that same amount of fear? Would I have felt the need to yell out my barely cracked window what I was doing so as not to be perceived like I was running from the police? And because I was uncomfortable and didn't roll my window down all the way, he was upset with me because he said, I'm the police. It makes no sense that you wouldn't trust me. And I said, I don't know you. And the history is that I should not necessarily trust you, which further angered him. And I could tell he was visibly upset, which made me even more scared. So when he asked me to get my driver's license, I said, "Sir, I'm afraid that if I reach for my driver's license, you're going to perceive it as me reaching for a weapon. So I'm not sure what I should do." This is actually my first time being pulled over in the early 2000s. And I was in tears because I did not know what to do. And it took days for me to sort of come down from that stress. And that was a simple traffic stop for failing to stop. I actually didn't fail to stop because there was no stop sign in that intersection. It was actually a flashing light, which is a completely different violation. But that's beside the point. The issue was how much stress it led to. And so whenever there is an interaction between myself and a police officer, for instance, there was a speed trap in my neighborhood just recently, and they weren't pulling people over to ticket them, to just let them know that the speed limit had recently changed. I immediately had that same reaction. Fast heart rate. I'm sweating as if I've done something wrong when I was actually going within the speed limit. They were just making the neighborhood aware of the upcoming speed limit changes. And I don't think police officers can truly appreciate, with the reputation that's out there as it relates to African-American interaction, how stressful their presence is. It isn't even a matter of being pulled over to get the ticket. It's their presence that can sometimes spark that discomfort. I had a patient recently who was raped and felt like the police weren't, not that they couldn't, but that they would not protect her because her experience as an African-American woman is that they don't protect us. And so that then leads to issues with public safety and personal safety. Because if I don't feel like the person who's hired to protect me can, then who is there to protect and serve if I can't trust them?
Right. So, I mean, it completely undermines that sense of security that I think that many of us outside of the African American community have a hard time fully appreciating. And
Exactly.
and I think that, but we've been kind of focused on the police. I'm curious about other institutions, because I have a hard time believing that as health professionals that we belong to a tradition that is free from all of this.
No, not at all. Not at all. As you spoke of, when I trained in California in our residency program, I was the only African American resident in my class. And so when I would go to a delivery, for instance, and I would ask what the indication was for the delivery, it was assumed that I had an attitude, that I didn't want to be there. And so I felt like perhaps I shouldn't ask those sorts of questions when it was absolutely appropriate, if nothing else, to fill out the appropriate paperwork.
And see, this is fascinating because you're speaking of this as an African American woman doctor. This isn't even what the patients go through.
Right.
But go ahead. I mean, I didn't mean to cut off your story. I definitely want you to elaborate. But I am curious about both sides of this. As doctors, what is experienced, then as what patients, what is experienced.
Right, and it's just in summary of that, it's just how I engage with folks within the institution. How do I engage with other doctors without being perceived as having a quote-unquote attitude? It has been said to me on several occasions, calm down, sister. And one, I wasn't upset at all. And two, I don't relate to people in that fashion. I don't call people sisters and girlfriends. That's just not how I communicate, but that's sort of the assumption as to how I would interact with people. On the patient side, my mom, I'm originally from Louisiana, and my mom has gone in to see her physician, and he has made comments about how you people it's hard for you guys to make changes. You people have to understand that you can't eat everything fried. And so I was upset because I'm like, well, what do you mean by you people? And my mom doesn't really eat a lot of fast food or fried food, and it's because of my counseling. So, what in your mindset makes you feel like everyone can be clumped together? And then because of that, my mom does not feel empowered when she has made changes, when she wants to let her provider know what other healthy changes she's made. What she wants to do is just go in there, get her cholesterol medication, and leave. She doesn't want to engage him in any conversation, one, because she doesn't feel that he believes what she says, and she's the mother of a physician. So I can only imagine people who don't have healthcare professionals serving as advocates, how restrictive it must be to be in a space where you don't feel like your provider trusts what you say, or that they make assumptions about who you are based on the color of your skin.
Yeah, and what I'm finding particularly powerful about these truths that you're telling us is that it reflects how these institutions, law enforcement, medicine, where, with law enforcement, this is an institution that is a source of security, or at least that's the ideal, that it is supposed to be a source of security for all of us as Americans. That, when we look at the institution of medicine, this is supposed to be a source of healing, and it needs to be a source of empowerment for all of us, regardless of who we are, what we look like as Americans. And, when these institutions are failing, on these basic missions, I have to believe that the impact on community health has got to be huge. I mean, the impact on individual health, I think, is pretty obvious. But the impact on community health, is no small thing.
Right, I completely agree with you. And I think when you're looking at the determinants of health, the way in which these different institutions engage people certainly affects the more proximal determinants. Because if I feel like from an institutional standpoint that the medical community is not necessarily going to provide my community with what it needs in regards to health care, then they're not going to seek out those types of services. That then leads to a whole snowball effect in terms of health outcomes. The same thing with engagement with the police. It's as if you're sort of clumped together based on whatever their previous experiences were, and you almost have to prove yourself different. I remember recently reading where an African American youth, when the police officer would pull him over, instead of pulling out his driver's license, he would pull out his student ID so that he could prove himself different than all the quote-unquote rest of us to help facilitate him not having a negative interaction. And I think when folks have to think about themselves in ways in which they separate themselves from their group, that can also lead to negative effects as it relates to health outcomes.
This has been such a fascinating conversation. You know, with our last part of this interview, I was kind of interested in something maybe a bit more aspirational. I kind of want to know, like, you know, what can we do about this? Because I want to believe that, you know, we can do better. We must do better. That, you know, that we pledge allegiance to, you know, justice and liberty for all. But how do we get there? Like, do you have any thoughts? Like, you know, does voting help? Or, you know, like, are there organizations that you can point us to who you feel are addressing these issues?
I certainly think that voting does help. I think it's important to pay attention to the agenda put forth by each of the politicians and to hold them accountable to that. I think making sure that this is a priority for them in how we address institutional racism, that's what you want to call it, and how it affects health in the long term and in the short term for that matter. I think bringing communities together collectively so that there is the recognition that this is what happens and how you move forward, perhaps having community organizations that involve the police and the community so that this open discussion can take place. Radio shows like what you're providing today, it's an excellent platform to initiate that discussion and then to move it forward. It could happen in a school setting. It can happen in communities, especially communities of color, where the police are directly involved so that there is that place for facilitated communication so that whatever the issues are the police force has, that can be discussed with the community and vice versa so that the conversation starts. I think that when you have instances, the unfortunate circumstance of what happened with Michael Brown, it sparks that conversation, but then it dies out.
Right.
You see all of this, you know, Facebook posts and all of this, everyone's passionate about it for, you know, a minute, and then everyone goes back to their status quo. And I think it needs to be on the forefront of everyone's minds because over time, no matter how many doctors are created, how many healthcare organizations are established, you're going to see these long-term health outcomes resulting from the stress that at the foundation is within that institutional racism that people experience.
Right.
Until we can get rid of that and address it, I think you're going to continue to see some of the cycles that we have seen for decades in terms of poor health outcomes in communities of color.
All right. Well, I really want to thank you. I pledge that Dr. America will be one of those platforms where we're not going to let this issue drift off into the background. We're going to keep coming back to it. I plan to definitely bring you back on so that you can add your intelligence and eloquence and insight to these kinds of conversations. And I thank you so much, Yolanda, for your time. And I encourage listeners to follow Dr. Hancock on Twitter. She's at Delta Health Doc. And thank you so much. We really, really appreciate you coming on the show today.
I appreciate you having me.
All righty. Well, thank you very much for listening, guys. When we come back, I will have a couple of closing thoughts and we will be signing off. Thanks a lot.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
All right. Thank you for coming back to the Dr. America show. I am your host, Dr. Sanjeev Sriram, and today's episode has been about the social determinants of health that played out in Michael Brown's life in Ferguson, Missouri. And it's this episode, I'm going to admit, this has been a little bit hard to follow, I think, for a lot of folks because we've wandered around a lot. I started out talking about Michael Brown and Ferguson, and then talked about Medicaid expansion, education as a social determinant of health, preschool, school punishment, and we ended with a chat about the impact of racial profiling on health. That's a lot to go through, and people may be wondering what ties all of this together. And for that, I want to bring it back to Ferguson and the people who lived there. Everything that we're talking about, poverty, access to healthcare, education, racial profiling, are all very real parts of very real lives. A lot of folks had a hard time understanding the riots that followed the death of Michael Brown at the hands of police officer Darren Wilson back in August of this year. And I don't think the rioting was right, but the anger is not wrong. In 1966, when there were race riots across this country, Dr. Martin Luther King Jr. was interviewed by Mark Wallace, and he reminded us that what we've got to see is that a riot is the language of the unheard. Again, a riot is the language of the unheard. At the heart of all these issues that we've talked about today, Medicaid expansion, increasing access to preschool, reforming school punishment, eliminating racial profiling from our public institutions and from our culture, at the heart of all of those things are opportunities to transcend our rhetoric and build realities for all of us. We can do better. We must do better. We pledge ourselves to liberty and justice for all. Let's act like it. All right. Thanks for tuning in. Thanks again for our amazing guests, Dr. Yolandra Hancock and Miss Linda Tirado, author of Hand to Mouth, Living in Bootstrap America. I want to thank everybody for liking us on Facebook and following us closely on YouTube. And let's do it again next week. Until then, salud to your health.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.